Hello guys, let's begin our topic. Hepatitis, one of the most important and favorite topic for examiners to confuse us. This topic is useful for both FMGs and NEET PGs. Let's begin. What is hepatitis? Itis means inflammation and hepat means hepatocytes. Okay, what are hepatocytes? These are the functional cells of the liver which are up to 70 to 80% of liver mass, and these hepatocytes are used in like metabolism, protein synthesis, you know well, right? Storage of nutrients, etc., etc., like that. And inflammation of these cells causes hepatitis. Now let's dive into the etiology. uh, there are many causes for the hepatitis, and one of the most important is alcohol intake, and second most is viral, and remaining others like bacterial, fungal, autoimmune, like our own cells destroying our hepatocytes, and certain drugs like that. Let's go into the viral hepatitis. These are of 5 types, and most important topic, and mostly examiners ask about the hepatitis B, because they may confuse us for the serological types, their genetic materials. As you observe, see, all 5 types have the same genetic material except B. That's why the B is also known as hepidna, in which DNA is present. So don't confuse in exam. Hepa B is made up of double stranded DNA. That's why its name is hepidna. Okay. And let's get into subtopic hepatitis A, which is incubation period is 4 to 6 weeks, and it may spread through fecal oral route, and we can diagnose it by HAV in stool and anti-HAV antibodies in blood, and prognosis is good for hepatitis A. And these are the single liners which can be asked in the exam. Most common viral hepatitis in India in children is hepatitis A, and most common viral hepatitis in India overall is also hepatitis A, right? And next topic is hepatitis B, most important topic, in which we will get the questions for the markers, right? HB, SCAG, HBS, CAB, like that. It will be present from this only. Next, the incubation period is also most important for all hepatitis types. So once check those also. Incubation period of hepatitis B is 30 to 180 days, and it may spread through horizontal, vertical, sexual, and needle pricks also. Horizontal means nothing but blood transfusion, like that, and vertical is nothing but mother to fetus, like that. And the overall most common transfer of hepatitis B is sexual. And if someone is exposed to hepatitis B with a needle prick, then hepatitis B immunoglobulin should be injected within exposure of 24 hours, and there should be post exposure vaccines too, but immediately we should give the anti immunoglobulins. And this is the image of hepatitis B, and make sure about the terms like HBsAg, HBeAg, and HBcAg. See, HBs, S means surface antigen, HBe means envelope antigen, and HBc, which means core antigen. Okay, with the help of these terms we can easily crack the questions. Let's first look about antigens. HBsAg, which is surface antigen, first antigen to be present, and increase in liver enzymes such as SGPT or SGOT, so that patient consults us with jaundice. Next one is HBeAg, which is envelope antigen. It is a marker of infectivity and replication. Next one is HBcAg, which is core antigen. It is not found in patient's blood. Next, antibodies, which is anti-HBsAg antibody. It can be found in cured or vaccinated persons. Next, anti-HBe antigen antibody. it indicates the decrease in infectivity and replication because the antibody is acting on antigen. So decrease in infectivity and replication. Next, anti-HBsAg antibody, which is first antibody to be formed. And as you guys know, like first antibody will be formed when we get infected is IgM. Later it is converted to IgG. Next, and this is the table. Like most of the examiners like it to ask us and confuse us. See, just remember, see the first column. Look at the first column, which is HBsAg, which is surface antigen. It means it says about Hepa B present or not. Next, see the third column, which is HBeAg, right? Which is envelope antigen. It means it indicates whether it is active or inactive. Inactive means decrease in replication or decrease in infectivity, like that. The second one, right? Next, so look at the fifth column, anti-HBc antibody, in which you should remember this, like IgM means acute and IgG means chronic, right? Simple. Now let's interpret the table. See, HBs is positive, which means Hepa B is there. Next, at the third column, HBe antigen is positive, means antigen positive means there is a replication and infectivity is going on, so it is active. And look at the anti-HBc antibody, which is IgM, which means acute, so it is acute hepatitis. Simple. Like and see the second one, there is no surface antigens, no envelopes, only core is present, which means the person is already got infected but is in window period, because see, like he is having the antibodies, right? So he is in the window period. Next, third one, see HBsAg surface antigen is present, means hepatitis B is present. Next, HBe antigen is also present, means it is active. Next, IgG is present, which means it is chronic. So, chronic active hepatitis. As simple as. And let's try the fourth one. C. IgG is positive, so it's chronic. And anti-HB antibody is present, which means antibody is present means the infectivity and replication will be decreased. So, it will be in inactive state. And HBs antigen surface antigen is present, so chronic inactive hepatitis. Next, anti-HBs AG antibody is present, but there is no core antibodies because the person is not infected, he is vaccinated, so only the surface antigen antibody is present. Next, last one is C. Anti-HBs AG antibody is present and core antibody is also present, which means he got infected and cured, right? That's it. Most important one, and if you didn't understand well, then again repeat the video. Okay, next one is chronic hepatitis B. If hepatitis B present more than 6 months, then it is chronic hepatitis. Microscopic findings are ground glass hepatocyte. In this image, normal granular hepatocyte is present on the left side. On the right hand side, it becomes the agranular hepatocyte. Granules are absent. That's why it is named as ground glass hepatocytes. And hepatitis B may increase the risk of end-stage liver disease, ESLD, end-stage liver disease, such as hepatocellular carcinoma and cirrhosis, for approximately about 20%. Next, acute hepatitis. For acute hepatitis, patient will be consulted with clinical findings such as nausea, vomiting, icterius, and right upper quadrant pain. And in PE, we may find yellowing of the sclera and painful hepatomegaly. After taking thorough history, the next step is checking the laboratories. First one is serum bilirubin. Generally, normal levels of serum bilirubin is 1% mg, 1 mg percent. But in the jaundice patients, it is 2 mg percent. Next, we will check the liver function test. There are 3 types of jaundices. First one is hepatocellular jaundice. Second one is obstructive jaundice, and third one is hemolytic jaundice. I will just tell the definitions about these. First one, about hepatocellular jaundice. It is a type of jaundice results in direct damage of the liver enzymes like SGPT, SGOT, like that. Next, obstructive jaundice. It results when obstruction in the bile duct between liver and the intestine, so that the bile is accumulated in the ducts. So serum bilirubin will be increased and jaundice will be came. Next, hemolytic jaundice. It results when there is excessive hemolysis, means excessive breakdown of RBCs. So the name is hemolytic jaundice. Let's check the table. First row, serum bilirubin. In hepatocellular jaundice, it will be increased. Obstructive jaundice, it will be increased. Hemolytic jaundice, it will be increased. But in obstructive jaundice, it is conjugated bilirubin. And in hepatocellular jaundice and hemolytic jaundice, it is unconjugated bilirubin. While moving to the ALT and ASTs, hepatocellular jaundice, which is occurred in liver, right? Like direct damage to the liver, means liver enzymes are affected. That's why they both increase. In obstructive, the liver is normal, so there is no involvement of liver enzymes. In hemolytic, red blood cells are infected, though there is no effect on liver enzymes, so it is also normal. Next, ALP means it is a marker of cholangitis, means about the gallbladder and bile, like that. So it is generally normal. In obstructive, bile duct is affected, so it is increased. And hemolytic, it is no involvement of bile, so it is also normal. USG. In generally, liver is soft and smooth, right? But for these patients, liver is hard and rough. And the general treatment is antiemetics, IV fluids, and giving rest. And this is the another pharma question where examiners wanted to confuse us. See, in chronic hepatitis B, if it is only hepatitis B, then we will give tenofovir or entecavir, like that. And they will ask you like chronic hepatitis B with compensated cirrhosis. Then is also the answer is same, tenofovir or entecavir. Entecavir is the best option. We might think for only hepatitis B we will give the antivirals, and for compensated cirrhosis we may give different drug. No, for both there is same treatment, right? Next, hepatitis C. For hepatitis C, incubation period is 4 to 40 weeks, and it spread through vertical, horizontal, and sexual, and most common route is parental. And the risk of end-stage liver disease with hepatitis C is very high, 80%. As we recall, for hepatitis B, it is approximately about 20%. For hepatitis C, it is 80%. And it is very difficult to diagnose the patient who came with hepatitis C, because hepatic manifestations are very late, occurs very late. like it will appear at the end stage liver disease time, they appear the symptoms. But we can diagnose with the help of hepatic manifestations which occur very early, like lichen planus, membranous glomerulonephritis, and joint pains like that. This is the mnemonic LMP. Next, end stage liver disease complications like pedal edema, ascites, caput medusae, esophageal varices. These are the end stage liver disease complications. And for hepatitis C, investigation of choice is PCR, which is HCV RNA, and ELISA also can be done, which is HCV antibodies. And treatment is ladipavir. Next, hepatitis D. Actually, hepatitis D, simply remember D is for dependent. Remember as D as dependent, because it depends on hepatitis B, because it lacks surface antigen. So it depends on hepatitis B. If the patient is having acute hepatitis B and hepatitis D also, then it is co-infection. If the patient has chronic hepatitis B and affected with hepatitis D, then it is called superinfection. This superinfection can increase risk of fulminant infection, which is also known as fulminant hepatitis. Fulminant hepatitis means nothing but liver failure. Liver failure within 4 to 6 weeks. Okay. Next, hepatitis E, which is the incubation period is up to 4 to 6 weeks and spread is through fecal-oral route. And these are some one-liners. Most common acute viral hepatitis in India in adults is hepatitis E. As you recall, in hepatitis A, in children, here, if they ask about children, it is A. If they ask about adults, it is E. Next, most common sporadic hepatitis in India is also hepatitis E. And overall, good prognosis for hepatitis E, except in pregnancy. In pregnancy, it may increase in risk of fulminant hepatitis. Okay. It is the hepatitis part, and let's do some activities. Question number 1. Comment on this serological report of hepatitis B patient. Let's see the table. IgG anti-HBC positive. Okay. Surface antigen negative. Envelope antigen negative. And anti-surface antigen is positive. So, what is your answer? Okay, pause for some time. Think about the answer and check the answer again. The answer is D. Explanation, let's check it. They say Ig anti-HPC is positive, which means Ig means chronic, right? And HPS antigen is negative, which means there is no surface antigen and there is no envelope antigen. See, there is no surface antigen and there is no envelope antigen. And they said anti-HBS is positive, which means this one, which is present in vaccinated or cured patients. But they given anti-HPC antibody, like IgG is given. So, it is cured, means previous infection with hepatitis B, right? Next, second one. Most common chronic viral illness is caused by. Next, third one. Fulminant liver disease is defined as encephalopathic coagulopathy developing within how many weeks? Okay, let's check the answers. For the second one, answer is C, which is hepatitis C. Chronic, check the explanation. Chronic hepatitis follows acute hepatitis C in 50 to 80% of cases. Chronic infection is common even in those with normal aminotransferase levels after acute hepatitis C, adding up to 85% likelihood of chronic HCV infection after acute hepatitis C. It is saying about that end stage liver disease. which, as we know, for hepatitis C it is 80% affected, right? Next, for the third one, fulminant liver disease, the answer is 8. It is subdivided into fulminant hepatic failure, which requires onset of encephalopathy within 8 weeks. We saw it like 4 to 8 weeks, right? And there is also another type which is subfulminant, which leads to encephalopathy after 8 but before 26 weeks, which means 8 to 26 weeks, right? And the answer is 8 weeks. Next, fourth one, most common cause of fulminant hepatitis in pregnancy. Fifth one, best marker for maternal to child transfer of hepatitis B. Okay, let's check the answer. Fourth one is D, hepatitis E. And fifth one is D, which is IgM antibodies. Let's check the explanation of fifth one. Most common mode of acquisition is during delivery. In case the body is exposed to virus, the immune system of the baby will produce IgM anti-HBC, which is the first antibody will be released from our body, IgM. Next, anti-HBC is the most valuable single serological marker of acute HBV infection because it is present almost as early as surface antigen and continues to be present later in the course of disease when antigen has disappeared. So, IgM anti-HBC will be most and best marker for maternal to child transfer of hepatitis B. That's it. Thank you guys. Please subscribe for more videos.